Paris, thank you for meeting with us today and speaking with us, and for your contributions to AOPT.
Thank you very much.
So the first question, what influenced you to become a physical therapist?
My father. I was born and raised in New Zealand, and in those days, you went straight out of high school and you went into nursing or law or medical school or physiotherapy school, as it's called in New Zealand. You didn't have a 4-year hang out at university and slowly make up your mind kind of thing. So my father's a physiotherapist, and his office was on the front of the house. So I got to know a little bit about it. Obviously the people who came appreciated him, and I took him a cup of tea every day after school. They no doubt said nice things to me about my father, and I was at a very young age, 17 or 18, when I had to make the decision what I was going to be. So I thought, well, I don't really know, but it looks all right. I'll be a physiotherapist.
All right. Throughout your education, what guided you towards orthopedic manual therapy?
Well, as you say, I went into physiotherapy, but within 4 months of being in the program, I was a student and I was instructed to teach a back class. Now, under socialized medicine, individual treatment is not the first line of therapy. What happens, the knees are put in one class, the hips in another, shoulders in another. And in my back class, there are about 12 patients. Now, those who need individual treatment will later be singled out and given it, but initially you start with a group. So I had my group on the floor, and it's supposed to last 30 minutes, this class, but in my student nervousness, I went through the list rather quickly. So I went through it a second time, and there was one man who was lying on his back, and he was supposed to put his left leg over his right leg, and he was having difficulty. So I went up and gave it a shove. I wasn't supposed to touch the patients, but I didn't know any better. I gave it a shove, and it was one of those moments in the world where there's no other sound, like when you utter a swear word when you shouldn't. Everyone hears it, right?
Right.
That's that sort of thing. His back cracked on the wooden floor. You could hear it resonate. Everybody stopped, and my instructor came out of her little place that she was watching all the students do these classes, and I got berated and sent home for the day. That was on a Friday, so I had a miserable weekend worrying about this guy, how much harm I'd done him. And on Monday, I even worried more because he didn't turn up to the class. I thought, how do I go to the hospital and tell him I'm sorry, you know? But 10 minutes later, he walks in, runs up to me, shakes my hand, thanks me for fixing his back. Because I'd manipulated, and that noise was the crack coming from the manipulative sound. So now it's time to go home and tell my father. Oh, I forgot to tell you, I got disciplined again, despite the fact that I helped the patient. I was very confused. So I went home, told my father, and he said, well, you manipulated him. I said, okay, we're going to learn that. He says, no, that's chiropractic. And I said, but it helped him. He says, I know, and that's one of the problems. We don't do that, but we should. And then he showed me his books. He'd collected several Suriax and Manel books on manipulation, and they're on his library shelf in his office. I hadn't noticed them before. And he read them, but he didn't have the courage, without instruction, to implement them. And so they just sat there. But he said to me, if this is your thing and you want to get stuck into this, I'll finance you to go overseas and study from these people when you graduate, on the condition that you come back and teach it, share it with your fellow physiotherapists. And I said, deal. And I spent a lot of time studying the spine and anatomy, studying everything I could about manipulative therapy. And a year after graduation, I went to England for a year, and Europe and America doing my graduate studies. I had scholarships and everything by that time.
How did you determine there was a need for an association for American manual physical therapy?
Well, the year was 1967, actually, and after having tried to set up a section on manipulation within the APTA, and there are only 2 sections then, private practice was one, and education section was the other. And many a therapist thought private practice should never happen because no one had any right to make money from treating patients. So anyhow, a section on manipulation they wouldn't consider. And at that time, John Manel and I were beginning to teach together. He's a physician after whom our academy has the Manel Award. And he informed me that he and a group of physicians, allopathic physicians, those are MDs, and osteopathic physicians, DOs, were about to form the North American Academy of Manipulation Medicine. So I asked if I could become a member of that, even an associate member. And Dr. Janet Travell, who you might know of in trigger point therapy, she was the incoming president of this to-be-formed body. And she wrote me a letter saying that joint manipulation was a diagnostic and therapeutic tool that should be reserved for physicians only. So no membership for me in their group. So I thought, well, we have to parallel this, and I set up the North American Academy of Manipulation Therapy. And over a period of the next 4 years, we combined Canadians as well as Americans. We grew to 992 members, bigger than any section, any of the two sections in APTA. And now I could deal with the APTA directly, the president and the board of directors. And they agreed that we could set up an orthopedic section. And so in 1974, in Montreal, we collapsed the North American Academy of Manipulation Therapy, and it became the Special Interest Orthopedic Group in Canada and the orthopedic section in the United States. And so we resided within that. And while it spoke for manipulation, the orthopedic section has much broader responsibility, the whole musculoskeletal field. So we never were entirely at home, certainly not in control, nor would we want to be. But it would be 17 more years before we founded the Academy.
Did you have any idea then that you were on the trail of developing an American association?
No, I thought the orthopedic section would be sufficient. We founded, chaired the founding meeting of IFOMT, and I was the first president of the orthopedic section. And the first president of IFOMT was Richard Erhard, an American, and the secretary was Peter Edgelow, an American from Canada, but he became a naturalized citizen, as have I, from New Zealand. So while we didn't have a body that could become a member of IFOMT, we were a position of influence, president and secretary, and then I became the next president of IFOMT. So it didn't worry us that we weren't a member of IFOMT, and so we didn't really need an academy at that time. We didn't think we did. The orthopedic section could not become a member of IFOMT because the sections, anyone can join a section, just pay the dues. And IFOMT said that only a body which has examination, clinical and academic standards can become a member. And a section can't do that. It can't set standards for membership. So we existed outside of everything. And it was Freddie Kaltenborn who finally decided this wasn't a good thing. And he came over here and brought us all together, and we met and we agreed to set up an academy. And we did that and had the standards in place and became part of IFOMT.
Despite the differences among the founding members, what drove you to look past these differences in creating this organization?
I really don't think there were any differences. I mean, there's different emphasis. You know, in any area of, well, take surgery, for instance. There's at least 23 different surgical procedures for lumbar spine. You don't need to know all of them. You'll need 3 or 4 of them. And those 3 or 4 you choose to do are the ones that suit you in terms of your skills, in terms of your personality, and the kinds of patients you see. And I think manual therapy is very much the same way. I don't think there are differences of opinions. There are differences of emphasis and approach. But someone like myself has learned from everybody, I think. Kaltenborn especially, Syriac certainly. I trained under him for quite a while. And then I've attended seminars by McKenzie and Mulligan and Maitland, and I see good in all of them, what they do. So I'll experiment with what I learn at their courses, and then I'll finally settle on keeping some of it and discarding most of it, because what I've got works for me. But for you, in your hands and your skill level and the patients you see, you might decide on a slightly different mix. We should be eclectic. We shouldn't be just doing it one way or another way. We should combine all of those to the best of our patients' needs. So the differences are not great. They really aren't. And we thought they might be, but when we got together, that didn't matter. The common goal of protecting the right of physical therapists to practice spinal manipulation in particular, and wanting to help our patients overcome any differences you might have.
What do you think is your most significant contribution to the Academy?
Keep me out of the way. So, well, I don't know. I founded the orthopedic section, and I founded IFOMT. And in the process of doing that, you create a lot of attention, but you're going to make some, I won't say enemies, but you're going to have some animosities. And so once you've got those organizations formed, and you see the talent that's there in other people, the best thing you can do as an initiator is get out of it. So I only stayed president of the orthopedic section for 2 years. It was a 4-year term, but I retired of 2 years to start the rotation. There were plenty of good people coming after me. And having founded IFOMT, I was asked if I wanted to run for president, but I said no, I want no office in IFOMT. And I knew that by saying that, I could get it formed much more easily. There'd be the people who disliked me wouldn't let that dislike get in the way of our succeeding to form this organization, which we did in 1 day in Montreal. After years of work leading up to it, you bring something like 12 countries together and they never heard of Robert's Rules. It's not easy to run a meeting like that, and I ran it. But I also, again, caused some little friction. So the best thing I could say, and I said it at noon that day, I will not be running for office. And the moment I said that, everything went much more smoothly. So I didn't run for office, but 2 years later I became president.
Briefly state 3 of your best accomplishments during your tenure at AOMT.
My tenure was as a member at large, and again, I retired early to start the rotations. Everyone gets a 4-year term, but you ask someone to step down. I said, I'll do that. I'm used to doing that. I don't think I did anything except work with everybody to get things going and support the president, Joe Farrell, who had a very difficult task. Yes, we now had AOMT, but in order to become a member of IFOMT, the International Federation, the board of directors told us that we would first have to get approval of the orthopedic section and have them say that we were the group that spoke for manipulation. And we knew very well that the executive that existed at that time, the orthopedic section, was not going to do that. They were not going to approve of the academy. Now, if you're smart about this, you know that to any business meeting, very few people turn up. Even here, they offer you a free drink to try and get you to attend. So we know usually about 30 people will show up to the business meeting, the orthopedic section. So out went the call, and we loaded it with 100 members of AOMT, who were all members of the orthopedic section. And so the motion to support the academy passed unanimously. Richardson, the president of the section, she had no choice but to work with Joe Farrell, the president of the academy, and they together went to the board of directors of ABTA, and the board approved us. And then with the excellent work that Carol Jo Tishner did on standards, we were accepted by IFOMT, even though they had a little trouble with the fact that we allow non-qualified members to be members, but by excluding them from the vote within our academy, they can't vote on anything of any significance at all. Might vote where we have the next party, but not on issues of standards and things of that nature. By excluding them, IFOMT willingly accepted us as a member.
Tell me something about yourself that most members wouldn't know.
I'm retired, totally. And I'm very happy with that. And I don't read journals. The orthopedic journal arrives from the section, and I don't know where to put it any longer. I certainly don't read it. I don't dog ear anything. I'm retired, and I was speaking to the students at my university, University of St. Augustine, just the other day, and someone asked me, what do you think about, and I didn't understand the question, but it was some new technique, some new something or other. I said, don't go there. I'm retired, and I've lived long enough to see other people that preceded me speak on matters that they were no longer well informed of, and didn't do themselves justice. I'm going to try and avoid that.
Of the founders of AOMT, choose 2 that you look up to and tell me why.
All of them. I wouldn't distinguish one from the other. But I will say, Joe Farrell, the first president, did a very good job. He's a charmer. You need to watch people like that. But he worked very well with everybody to get the whole thing through and to get us into IFOMT and so on. So I would say him because he was first.
Okay.
I nominated him, by the way, because I thought he was the right person for it.
What are your thoughts on the relationship between AOMT and IFOMT, and what is the value there?
America's got to be very careful of not becoming isolationist. We tend to do that between the wars. We get involved in one war, First World War, and then we do nothing about the world. It goes to hell, we have to get involved again. We tend to get into something and then out of it, and you can look at the Middle East the same way. We're part of the founding of IFOMT. If you believe in the exchange of ideas, and if you think that there might be a good idea and some good research coming from another country, then you behove yourself, if you're really interested in offering the best to your patient, to make sure that you assess that knowledge as long as you're a clinician or an educator. You need to be part of the world scene. We're one world. If we left IFOMT, then it wouldn't hurt them at all, but we'd hurt ourselves. So we need to be part of it. Now, when we weren't part of it for some 17 years, it didn't matter. We still went there and attended, but we had no say in their business. But their business is putting on first-rate conferences and sponsoring research and encouraging it. So we could be part of that. But I'm afraid if we left it, you'd find that we wouldn't pay it much attention. And I think we'd lose out on that. We need to be part of IFOMT.
How do you think this relationship can be further solidified and improved?
I think that comes down to things like vision. An organization needs a vision statement that inspires people. We're having a panel discussion here on Saturday, and part of it's coming up to discuss the academy. And in preparing for that, because I've been invited to speak, I looked at the vision statement and I found it to be totally inadequate for today. So I'll address that at that time. But you have to inspire people with a vision statement, and then you have to work to it. You may never get there, but that's what inspires you. And we need that.
How do you feel AOMT has influenced and benefited the APTA?
Well, we're a leader in areas like residencies and fellowships. And I think that's been very important, because the future of this profession will be one day, should be one day, that you graduate and go automatically into a residency. And then you may or may not choose to go on to a fellowship. So we support that in principle, and that's got to be the future. I'd say that's the main thing. The next thing is, however, we have fostered the art and science of physical therapy by specializing in an area. Now, I'm never against a generalist who practices in all areas of physical therapy. We need those people, particularly in rural areas, but we need to specialize to advance the field. So I think the Academy, in specializing in a very narrow field of manipulation, manual manipulative therapy, has helped advance it and cement it and protect it. Protecting it's important, because there are those that would take that away from us. There's always been those who want to take it from us, primarily chiropractors, and the Academy is a great source of strength financially and in terms of personage to help keep defending our right, because we can't afford to lose any area of practice that is of advantage to our patients. We must offer the best to our patients, whatever area that is.
What role has AOMT had in the formulation and submission of legislation defining and supporting the utilization of manual therapy within the APTA and at a governmental level?
I'm not very cognizant of that. I know that we have a manipulation task force, and task force usually means, by the very title, it's a short-term kind of thing. It's been going on for 20 years now, and it meets about twice a year. And the Academy is supportive of it, again financially and in terms of persons. And we watch everything that's going on in conjunction with the APTA in each of the various states when people are trying to restrict our rights to practice. So I think that's probably the main thing. But I'm not on the ball there. I don't go to those meetings any longer.
Okay. From your perspective, how has AOMT influenced our profession?
It continues to make sure that those who are practicing and are interested, and those who teach, who should be here, manual and manipulative therapy methods, are going to be exposed to current thinking and different ideas and current concepts, and see them debated and discussed, and that will help them define themselves as clinicians or speak better and better informed as academics. So I think that's a very important contribution.
What do you look forward to the most at the AOMT conference each year?
For me now, meeting friends, maybe hearing something new, but I won't be sitting in on most of the clinical sessions. I have a couple of projects I'm involved in right now, and I want to be on top of them. So I think it's just meeting friends and supporting them. Doing something like this with you, it's a joy to me to be able to share my experience. I'm, as a person throughout my life, I've studied history. That was my top subject at high school. And I always read biographies, autobiographies, historical novels. I enjoy that. So I think if you don't know history and the mistakes of history, you're bound to repeat them. And if you don't know history and the right things that came out of history, you're not going to make the right decisions in your own life or within an association. So history to me is interesting, and I enjoy it very much.
For students and PTs who are not members of the Academy, what do you believe should be marketed in order to attract their membership?
Well, if they're interested in manual and manipulative therapy, now you could remember a physical therapist has a whole range of practice areas and responsibilities, and they should be competent in all of them, but not expert in all of them. But if they choose to be expert in manual therapy, then it behoves that they come to a meeting like this. But the problem is greater than that. If you look at the number of physical therapists out there, then ask yourself how many are members of the American Physical Therapy Association, and the majority are not. So the majority are not members of this association. How are they staying up with their field? They're not getting the Journal of Physical Therapy, which I'll agree is a bit too technical and too research-minded for the average clinician. But if you do join the association, then you join the section. And the orthopedic section, having 17,000 members, I think, or more now, is the largest. And it caters to the whole musculoskeletal area. And through their journal, JOSPT, through their bulletin, and other services, you will be able to stay current in the practice of your field. And I think that behoves the professional responsibility of every physical therapist to be a member of the association, decide on what journals and what areas they want to engage in. Unfortunately, not enough people take their profession, it's not just physical therapy, it's other areas too, take it seriously enough in terms of social consciousness. But we encourage it.
What is your vision for the Academy as it continues to evolve?
No, I wouldn't have a vision. I'm going to be interested in, well, I do. I'm going to be interested in the panel discussion on that because I'm going to propose a vision for it. And I forget exactly what I sort of wrote, but it's to be the leading organization that speaks to the excellence and the quality of practice and research in manual and manipulative therapy. To be the leading. Now, I don't say the best, but to be the leading. Now, we may never get there. There are other countries involved, and maybe that role belongs more suitably to IFOMT, the parent body, if you like. But we should try to be the leading. Why not? That's a goal worthy of reaching. If you read the present vision statement, which is just totally not inspiring to me.
Do you believe AOMT will survive another 25 years, and why?
Well, I'm sure it'll keep surviving. I don't see why it shouldn't. One of the issues it has to decide is whether it's manual and manipulative therapy or whether it's musculoskeletal therapy. In Australia, we have an example of this issue. The Australian Manipulative Therapy Association, the MTA, Manipulative Therapy Association, changed its name to Musculoskeletal Therapy Association because they wanted, obviously, to have more attendees to appeal to a wider audience. The danger of that is you lose your primary emphasis. That's not so likely to happen in the United States because we have the orthopedic section speaking to the broad field. And if we changed AOMT to musculoskeletal instead of manipulative, we'd be competing with one of our own sections. And that would not be a good idea. So I think we're somewhat protected from that, and we'll stay with manipulative therapy. And that's where we should, and that's where IFOMT needs to be very careful too. Because at our last meeting in Glasgow, there were speakers there who clearly had no idea what manual manipulative therapy is about. While they had interesting topics, they didn't relate them to our field sometimes. And there were papers on tendon Achilles problems, which has nothing to do with manual manipulative therapy. At least it could, if they were correcting something along those lines, but the way they presented their paper, it didn't. So that's watering down the primary emphasis of group. Just make the conference shorter and meet less often if you don't have enough papers. But don't dissipate it. Don't try to please everybody, and don't be out there just to make money and have a big conference by adding acupuncture and everything else to it. Unless, of course, acupuncture helps with the administration of manual and manipulative therapy by relaxing musculature, easing the pain so the patient can move quicker. Exercises has a role in manual and manipulative therapy. It's part of the treatment. You don't do manual and manipulative therapy, particularly manipulation, by itself. But you got to draw the lines, you don't get too far away. And focus on what our primary focus is, and don't dissipate it. Or you lose your primary audience, and the next coming generation will not be inspired with this field, and we may lose it entirely if we're not careful.
Well, Dr. Paris, I'd like to graciously thank you for your time. Is there anything else that you'd like to add before we close?
No, I thank you very much for your questions. I thought they were very good, and I think some of them, most of them, were very important. So I appreciate you giving me your time to ask them of me.
I truly enjoyed it. Thank you so much.
Thank you very much.